in each country. Our expected results: increased number of human rights violations, increased number of reports on human rights violations, increased number of CSOs investing in the reporting mechanism, pro bono lawyers to support litigation, and just human rights lawyers in general. Greater confidence and increased number of reports in reporting human rights violations to duty bureaus free of stigma and discrimination, and as well as increased accountability.
Because I wanted to see it. Jesus, don't be so mean.
Have I said anything? Go ahead. Okay, so key priorities are 2, implementation of model legislation and repeal punitive laws. For strategy, sensitization education for parliamentarians and technocrats, read the model legislation, monitor the rollout of the model legislation in each country in collaboration with CSO partners. We had said that basically what we're seeing is that people are aware of the model legislation, but there's no follow-up as to whether it's being implemented. So we thought that that was a big gap. Our actions: adapt/adopt model legislation, review related legislation to ensure complementarity among all legislation, continuously conduct legal environmental assessments or monitor to support rollout, revision, adaptation of that model legislation. Partner/collaborate, support champions for change, conduct LAs with a view to identifying laws which will work counter to international conventions, use model legislation to make suggestions for amendments to laws that are barriers to access, engage with the Ministry of Foreign Affairs and Legal Affairs, or whatever the name of the organizations with that responsibility in country, to work to ensure that the international commitments are translated into legislative changes. And train CSOs in policy monitoring as a mechanism through which governments can be held accountable for the laws and amendments to those laws. So in moving on to results, improved policy and legal environment, which should improved policy and legal environment, which should recognize and protect the rights of all and align with the international commitments, increase compliance with international commitments, increase capacity of CSOs to monitor policies through shadow reporting on violations, as well as the production of policy briefs. Number 3, establishment of regional human rights commission. There is need to establish an independent and impartial body with the primary function of investigating, reporting to Parliament, and on all human rights violations. Establish framework legislation to support redress and resolution of human rights violations. Actions: need to investigate international guidance on the development of human rights commissions. Human rights commissions should be a critical platform for redress for the average citizen, providing, supporting reconciliation and reparations. Establish impartial, independent human rights commissions to support, redress, investigate human rights violations, and establish a framework legislation to support the redress. Of course, the expected results are similar to what we have mentioned before. And the last one, access to justice. The government needs to recognize the health and security needs of migrants, irrespective of their status. Provide social protection and access to essential services for migrants. Enact legislation to protect and recognize the rights of migrants. And we also wanted to incorporate differently abled persons under the theme of access to justice. Development of development of a policy framework for the provision of services to migrants. And of course, we're talking about undocumented migrants, those migrants that have the most issues with regards to access. Regardless of immigration status, reframe the narrative and approach to government, read migrants by focusing on health, economics, etc. Provide resources to translate materials and documents appropriate for the community, for differently able, for persons who speak a different language, etc. And our expected results: higher redress for those migrants and persons who are differently able. Any questions? Oh, sorry, I'm told not to ask if there are any questions. Yeah. Thank you.
Sorry. Thank you very much to Sanya and her assistant, Yolanda. We now have group 4. I believe it's Shalom, presented on behalf of group 4. Okay.
Hello, good afternoon again. So group 4, financing and sustainability. And our first priority area was pool procurement. I will just go over the message because we refined it a bit. PANCAP will work with governments, donors, and regional suppliers to utilize cost-saving approaches for drugs and commodities, including lab supplies, through the most efficient mechanism. For example, price negotiations, pool procurement, and efficient supply chain management systems. Our target audience would be heads of government, so we're looking at the regional level, COSAD ministers of health, finance, and PSs, Ministry of Finance and the PSs from Ministry of Health and Finance, national procurement bodies from those ministries, program implementers, which include the National Aid Program managers, and regional suppliers and donors. The strategy which we identified for pool procurement surrounded engaging in price negotiation mechanisms. And the action would be to review existing mechanisms or machineries and document best practices and procedures. There are a number of best practices that exist within the region. To name a few, we have the OECS Pharmaceutical Procurement System, the PPS, what PAL is doing, the support PAL is offering the region, what PEPFAR and Global Fund has been offering, and of course our individual country programs can also serve as best practices. Our second priority area surrounded CSO consolidation and support. So that includes packaging of CSO services, CSO contracted as mentors, fee for service, and we included here some amount of governance, leadership, and resiliency for CSOs. What is our message? We want to explore multiple financing, resource mobilization, and we broke resource mobilization out a little so that at least there's some understanding of what we're talking about. So we're talking specifically about financial and technical support, HR support, in-kind contributions, technical support, which was mentioned before, assessing specialist services, etc. So these mechanisms, these financing mechanisms, we hope that they will result in sustained CSO programs and operations. Our target audience there are our CSOs, our governments, private sector donors, and even our discussion revolved around even faith-based organizations. What are some of the strategies identified there? Just in brief, to develop the capacity of CSOs to key implementers and to advocate for their own sustainability. And we categorize some of those things that needs to be fleshed out as organizational development, finance management and accountability, etc. We also wanted a strategy to highlight the orientation of CSOs as viable and sustainable entities. And finally, improving the enabling environment and the state of actors to collaborate with CSOs and include them as major contributors. And some of the major actions that we discussed was surrounded institutionalization of human capacity services, human capacity building for CSOs, mapping of services offered by CSOs, administrative, operational, and financial management, and support for those major pillars for CSOs, governance and leadership, succession planning, organizational development, public-private partnerships, and the discussion also encapsulated stratifying, categorizing, and to some extent, certification of CSOs, so they can now market themselves in these key areas of technical support that they can offer. Because one of the major things we discussed, or one of the major items we discussed here, is social contracting. All right, as we move ahead. Resourcing and sustaining existing laboratory networks. The message there, PANCAP will advocate for a pivotal role of laboratory networks and services in achieving health for all. The target audience there is the governments, the ministers of health, PSs, PLHIV, national labs, Ministry of Health, the Bureau of Standards, suppliers, donors, Global Fund, PEPFAR, etc. What are the key strategies discussed? One second. So, because we have the expertise of Valerie in our group, we were able to get a little bit more into the details of strategies. So we're looking at quantifying the costs, benefits to be derived from strengthening lab services, models for comprehensive costing of lab services, and we were able to break this out: HR, maintenance, equipment, reagents, quality assurance activities, management and operationalization of regional networks, and this includes validation, training, certification, etc. Quantifying the costs and the benefits of doing all of this. What models for comprehensive costing of lab services exist within the region? We wanted to pay some attention to that, and the activities will result. Finally, we looked at sustainability studies for understanding and advancing tools. This is basically focused on strategic information and research. And the message here is PANCAP will advocate for a greater use of strategic information and research to guide and inform decision-making, resource allocation, and sustainability in a timely manner. In our target audiences, in addition to the groups named before, we looked also at CARFA and the role of CARFA in this activity and around strategic information. What are some of the strategies to advocate for the development of a resource agenda that's informed by national strategic plans and key frameworks? Example, CCH4, the SDGs, etc., specific for the Caribbean. We also wanted to evaluate the vulnerability and sustainability of the Caribbean response programs, and to some of the major actions: to conduct a review of existing national plans and frameworks, and to conduct and engage key stakeholders, state and CSOs, donors, etc., in the assessment of their needs and gaps in some of the existing programs. We also want to evaluate existing models that measures vulnerability, sustainability, and USAID did some work in this area, as well as WHO, because the focus will be on addressing corrective actions towards the response. And finally, I just would like to mention, although we will use some time to flesh this out some more, we also dealt with the integration of primary health care, SDGs, and SRH, HIV, and NCDs. I know that is quite a mouthful, but our message there going forward would be PANCAP will advocate for integration of SRH services into primary health care as a key strategy for sustainability through the alignment with the SDGs, the MSDF, which is the Multi-Country Sustainable Development Framework in the Caribbean, CCH4, and other mechanisms. Another message basically surrounds PANCAP advocating for the use of existing frameworks, which includes some of those mentioned before, which would help to leverage resources for the HIV response. We still need to flesh this out a little bit more, but this is where we are at the moment. Thank you very much.
Thank you very much, Shalom. And thank you everyone for your deliberations, more importantly, the patience and the stamina to see this through over the last 2 days. I really appreciate the high level of engagement, and many of you had to be forced to go to lunch, given your commitment to this process. And so it's important that we recognize that as Sarah seeks to pull all of this together, that we want to frame this within the context of that recent PANCAP assessment and the unanimous decision of the PANCAP Executive Board, which was endorsed by the Council for Human and Social Development Ministers of Health in September, for us to go with option 2, which is streamline and refocus the partnership. And we're in the process of really defining how we will streamline and refocus our priority risk coordinating committee, which is the technical committee of the PANCAP Executive Board, began that process. And we have agreed that we will hold a special technical meeting to try and review some of the findings, additional findings of the assessment to really inform the streamlining and refocusing. And so we would want to ensure that this particular strategy, which will serve as a framework for advocacy as we move forward, is really framed within that context. It is important for us to acknowledge that we have already started the work. Some of this work that you have identified has already started. And so we will, with support from the current Global Fund grant, as well as other support from partners, seek to implement those activities once they're fleshed out from the major actions over the next 2 years, because this advocacy strategy is for 5 years. And so it goes until from 2018 to 2022. We know that the current Global Fund grant ends on the 30th of September 2019, and we hope to have another project Global Fund grant from the 1st of October 2019 that will take us to the 30th of September 2022. And so I see this as an opportunity also as we begin this whole regional dialogue around what the focus of the new Global Fund concept note should be, is that given all that we have identified, is that there's an opportunity for us to ensure that we utilize the funding that we will receive from end of 2019 to really accelerate the implementation of many of these activities here. But because the grant funding is going to be focused primarily on sustainability and of course keeping key population as a focus, we have to also think about how do we sustain a lot of what we are proposing beyond 2022. And so we must take that into consideration. We are reminded that we now have a PANCAP resource mobilization strategy, and we are currently operationalizing that strategy so that we will be in a better position to mobilize funding both at the national level, at the regional level, and from some of the non-traditional funding sources. I did share with you our plans to engage with the Caribbean diaspora and also beginning to work, particularly in the United States, through the Caribbean caucus within the Congress as we move forward. We have re-engaged with the private sector, and so the intention is to leverage both financial as well as technical support, and that's why I'm glad that the group that looked at financing and sustainability really took into consideration that so when we talk about financing and sustainability, it's not just about money, but we also have to take into consideration technical as well as the other human resources that get the job done on a daily basis. In terms of the next steps, Sarah is going to pull the first draft together, and then that will be sent to me. We will circulate it to you. And I would like to encourage you to spend some time once you receive the draft and to provide us with feedback. We will give you a time frame within which to provide the feedback, and so that Sarah can then finalize the strategy. As I said to you, it's 5 years, and so we will have to be realistic as we review what is being proposed and look at what can be really achieved within the next 5 years, and to ensure that those are areas that we will focus on over the next 5 years. I want to quickly put up the presentation in relation to the opportunity for new funding. We will not proceed with the regional dialogue, given the fact that it's just about 3 o'clock. And so to really give you a sense as to the process that we will need to undertake over the next few months as a region to develop this concept note. And so according to the presentation that we received from the Global Fund at the COSAD, and I have done some amendments to that presentation, that the Global Fund Board, of course, made a decision through the new allocation, because you would have remembered that in September last year, the Global Fund, at its 5th replenishment in Canada, mobilized the $12.9 billion US. And so from that, the Latin American Caribbean has received an allocation both for the countries, as those countries that remain eligible, as well as for multi-country grants. And so we have for malaria $145 million, tuberculosis $65 million, and TB $50 million. But this that you're looking at includes both the country allocation and what has been allocated for multi-country. And so the high priority for the multi-country approach, and these are the indicative figures, for Latin America and the Caribbean, a total of about $205,000 US, and this represents about 35% of the allocation. And bear in mind that this allocation is not reflective of most of the regions of the world, but really is representative of Latin America, Eastern Europe, Central Asia, as well as Southeast Asia. And of that, 17%, which is 17 million, which is 34%, has been allocated. You touched it? has been allocated for Latin America and the Caribbean. Now, what the Global Fund indicated is that for the last period, there was 50 million in total allocated for Latin America and the Caribbean for multi-country, of which approximately 18 million was allocated to the Caribbean. Now there is only 17 million allocated for Latin America and the Caribbean for multi-country. So they estimate that the Caribbean will not get more than about 7 million. It might be less, but not more than about 7 million. And so it's important that we recognize that given the significant reduction, and we will need to submit one regional application. And that is what the Global Fund is saying, because